So now let's come to the topic of cell injury and adaptations. This is a very important topic, guys. You should understand this. And we'll start with its first competency, that is, what is cell injury? Basic. Okay, so what are the causes of cell injury? What are the mechanisms of cell injury? What are the types of cell injury? What are the effects of cell injury? And what are the clinical significance of cell injury? So let us understand, what do you understand with the term cell injury? So suppose if somebody, comes and hits you. So what is that? Injury. So cell is like a small human being only, okay? If somebody comes and hits him or hurts him, it's an injury, okay? So cell injury occurs whenever the cell is injured, whenever the cell is targeted by some agents, and he will get injured. So whenever I'm talking about cell injury, you should understand that what are the causes of cell injury. So easiest way of kill you is hypoxia, isn't it? Stop your oxygen. Same way, the most common cause of cell injury is hypoxia. So this hypoxia can occur due to three causes, okay? First and the most common is ischemia. What is ischemia? Decreased blood flow to the tissue. So whenever the blood flow to the tissue is decreased, it is ischemia. The second is decreased oxygen carrying capacity of the blood. Blood is coming, but it's not carrying the oxygen. What is this called? Anemia. The second important cause of cell injury is anemia, that is decreased oxygen carrying capacity of the blood. And the third important cause of cell injury is cardiorespiratory arrest, that is heart is not pumping and respiratory system is not oxygenating. So that's cardiorespiratory arrest, okay. So these are three important causes of hypoxia, and hypoxia is the most common cause of cell injury. So remember, what are the three important causes of hypoxia? Ischemia, that is decreased blood flow, okay, anemia, that is decreased oxygen carrying capacity of the blood, and the third one is cardiorespiratory arrest, that is heart and lungs are not working properly. So these three cause hypoxia. So that's the most important cause. Apart from that, there can be other causes of cell injury also, like physical causes, physical, chemical and infective. Remember three: physical, chemical and infective. Physical, like extreme heat, extreme colds. Whenever you go to, let's go to very snowy areas. If you look at the soldiers who work in Siachen, okay, and they are stuck in cold for longer period of time, their tissues in the foot they'll get chilblains, isn't it? So they'll get necrosis of the fingers. So what is happening here? Injury. So extreme cold, extreme heats can cause cellular injury. What about chemicals? See, chemicals, even excess concentration of salt and sugar can cause, hypotonic solutions and cause cellular injury. Or certain poisons, certain heavy metals which can act as poison. Cyanide, as soon as you give it, immediately the person dies. So cyanide, arsenic, these heavy metals can cause cellular injury. Or fertilizers, okay, so fertilizers, when you put it in the farms and you suddenly take it, they are prone to cause you cellular injuries, isn't it? So a lot of chemicals can cause cellular injuries. It can be simple normal chemicals which are in excess concentration, or they can be poisons or heavy metals, or they can be other chemicals like fertilizers or pollutants like pollution. We are exposed to carbon, so much carbon, isn't it? So like Delhi has become a gas chamber, isn't it? So carbon, so much carbon is there. It's causing your lung injuries. So all this cause cell injuries, okay? That's chemical. Now coming to infective, all of you know COVID virus has created havoc, okay, since the past 2 years, okay. So all of you know, so infective organisms like bacteria, virus, fungi, okay, or even parasites, protozoans, all can infect the cell and cause cellular injuries, okay. So there are a lot of biological agents which have caused cellular injuries. So COVID virus was a virus, caused so many deaths, so many cell injuries, isn't it? So that is infective causes. Apart from that, the other important is genetic causes. Genetic causes means even if there is, single nucleotide mutation like sickle cell anemia, if it occurs, it can cause cellular injury, or thalassemias can cause cellular injury, okay, or any inborn errors of metabolism like Gaucher disease, okay, can cause cellular injury. So even small chemical alterations which can occur at the genetic level can cause various types of cellular injuries. So genetic causes are one of the very important causes of cellular injuries, okay.